Well, turning now to a new effort to bolster the healthcare industry in Western New York, as a special class of graduates celebrated the beginning of a new chapter in their careers tonight. Well, it's an industry that's struggled in recent years. Taking a look at this graph from the Department of Labor. Now, in November of 2018, the Buffalo Niagara Falls metro area had more than 15,000 hospital workers, but that number dropped sharply during the pandemic, in no small part due to high rates of burnout among nurses. Now, early in the fall of 2021, the industry lost 2,000 workers before it rebounded. And since March of 2022, the number of hospital workers has steadily risen, but there are still 1,300 fewer hospital workers now, more than there were 5 years ago. Now, that's why tonight I headed out to a special graduation to hear from people who are working to make a difference in the healthcare industry here in Western New York. I spoke with Catholic Health and an RN in the field about their new approach to bringing nurses into the field more quickly. Catholic Health's first nurse residency program graduation, bringing in 12 new nurses into the workforce. The thing is, they've already been training in the workforce for the last 6 months through the healthcare system.
We want them to stay with us. We want them to be happy with their profession. But it's very stressful when you're a brand new nurse. There's a lot to learn, and your experiences that you have in school don't necessarily mimic what you experience when you start.
Joyce Markevich is the president and CEO of Catholic Health. She says the program helps the nurses gain confidence in their abilities to be a healthcare worker. The University of St. Augustine for Health Sciences states, given the growing demand for healthcare services across a multitude of specialties, reports project that 1.2 million new registered nurses will be needed by 2030 to address the current shortage. Catholic Health is working to accommodate the rising demand.
About 18% of new nurses turn over in the first year. They think they know what they want to do, and then they come out into the real world, and it's a little bit different than what they expected.
Qualifications for the program are graduating from a nursing program and getting a passing or collecting an RN license. One thing that sets them apart is the preparedness, according to Catholic Health corporate nurse educator Michael Macri. When students graduate the program, they're automatically employed as Catholic Health critical care and emergency nurses.
They have the knowledge. They have the hands-on training and simulation to prepare them for those scenarios that can happen in a moment's notice.
There's also a 360 camera in the room that allows instructors to debrief with the students afterwards.
We can simulate different vital sign changes, different abnormalities with their breathing patterns, for example. And really one of the biggest benefits is that it allows our residents to sort of see variations from normal.
Markevich, who began her career as a registered nurse, tells me that she wishes there was a program like this when she became a nurse because she had an experience that left her feeling doubtful.
When you're in a residency program where somebody is supporting you and they're giving you those opportunities to have those experiences, but they're by your side and they're explaining things to you, and you know that you have somebody to rely on, it's a very different experience.